The massive medical campus at the University of Michigan is home to a number of leading researchers, doctors, and state-of-the-art technology. But the impact of the work being done here goes far beyond the university and even the state of Michigan. Nancy McCauley-Branstetter went to the medical campus to discover the influence of one of those doctors and the machine he invented, called Ecmo.
For Heidi and David Butts, a young couple living in Southern California, it was the happiest time.
We were newly married. I was pregnant for the first time, had a completely normal, healthy pregnancy.
Then, out of nowhere, things turned for the worse.
He was born by cesarean section, and the minute they did that incision, it was clear that things were very, very grave, having to do with an infection in his lungs. I recall that when they delivered him, nobody bothered to tell us if it was a boy or a girl, and that was my first clue that if they didn't even have the time to say that things were heading south.
Before they could even hold him, their newborn was whisked away to the Neonatal Intensive Care Unit, or NICU.
The head of the NICU pulled me aside and said, there's a chance here that if we could get him to Children's Hospital, that he might go on this procedure called Ecmo.
Ecmo, a relatively new device and procedure, offered Heidi and David the first ray of hope that their newborn might survive, and it existed thanks to a surgeon and researcher at the University of Michigan.
The first Ecmo patient was in California, and we stay in touch with her. She's 35 years old.
Today, Dr. Robert Bartlett is an emeritus professor of surgery, and even though he's technically retired, still an active researcher at Michigan.
You were in residency in Boston, and what were you seeing? What got you to be thinking about the Ecmo?
In the middle 60s, heart surgery was new, and the mortality for major operations on small children was very high. Half those children died. And our thought was to use the heart-lung machine. It turns out that the artificial lung part of the heart-lung machine in those days was very damaging to the blood, and that was the reason that it was a lethal instrument. So we modified the lung to make it with a membrane like the normal lung, preventing blood from seeing oxygen directly. And it turns out that that was the first step in being possible to use the heart-lung machine for days at a time.
Tell me about your typical patient. Is it still babies?
Through the 70s and 80s, most of the use of this technique was applied to newborn infants, but also we're treating adults with severe shock or lung failure of various types.
University of Michigan professor of surgery, Dr. Ronald Herschel, has been Dr. Bartlett's colleague since 1983.
What was it like before the machine?
Before Ecmo, there was nothing you could do. You sat and just watched as somebody died.
Dr. Gail Onick, the director of pediatric Ecmo, gave me an overview of how Ecmo works.
This is Ecmo today, and the machine itself supports a patient who has either respiratory failure or cardiac failure, or both. And so what Ecmo provides us with is the ability to put a patient sort of in hibernation, and we just let the body heal. It can be anywhere from 2 days to months, but they come off the machines and they go home.
By removing the workload from his distressed newborn lungs and giving doctors the space they needed to treat the underlying infection, the Ecmo gave Heidi and David's son Jack a chance at life.
So these pictures that you're seeing are me meeting our son for the first time and seeing these machines.
Wow. And I can see the tubes. This is the blood that needs the oxygen and going back in.
Right, with the bright red blood going back in with the oxygen in it.
So tiny.
Yep, and there he is, the first pictures out of that intensive care unit.
So he went through the Ecmo and then he was fine?
It's been as if nothing happened since day 27 when he came home.
To date, more than 43,000 Ecmo procedures have been performed, with 27,000 survivors worldwide. Every year or two, many of the researchers, practitioners, and survivors gather at a park in Ann Arbor to celebrate.
This is a picture of some of the people gathered at the
picnic, and we get together all of our graduates every year.
It's a grand group.
Yeah, it's a lot of fun. The most important thing we do is generate all these fellows who go out in the world and take good care of patients.
If Ecmo was his only contribution to medicine, the story of Dr. Robert Bartlett would be remarkable. But he hasn't just saved lives, he's changed them.
Dr. B is well known all over the world. When you learn about Ecmo, you learn about Dr. B. And in 1995, I said to him, you know, I have no research experience, but I'd be happy to come for no pay and work in your laboratory. And he said, sure, come on down. He gave me a project that was not working, and he said, go with it and figure it out.
While he's retired from practicing surgery, Dr. Bartlett goes full steam ahead on his other passions, mentoring and research, which he tracks on a very full whiteboard.
This is our sort of scoreboard.
Okay.
So there are 8 separate projects that are running in the lab simultaneously.
As his collaborators all attest, Dr. Bartlett runs a fast-paced research lab that promises to save even more lives moving forward.
And then we're working on using Ecmo to increase the number of donor organs and culturing organs outside the body.
If we're able to increase the organ pool by improving the quality of the organs, it will create a big impact in organ donation.
I'm studying the development of an artificial placenta, which is basically trying to solve the problem of extreme prematurity.
He's an idea machine. He comes up with lots of really interesting ideas. As an engineer, those are the things you want to work on. Like, that's a crazy idea that would work.
Everyone I've spoken with today has talked about how something magic about that lab. What is it?
Well, I think a lot of it is the magic of Dr. Bartlett. First off, an incredible human being, and just so bright, with so many creative, innovative ideas. He's always looking at better ways to do things, even with the things that he has already developed. So, for instance, Ecmo, even to this day, he's working on better ways to do Ecmo, better ways to help patients. You know, he's an incredibly compassionate and caring individual. He really does this out of his great desire to help patients, to help humanity.
That passion for finding ways to help the sickest of the sick has made happy endings possible around the world. It ripples out from lives touched by a special researcher, mentor, and physician working in a special place.
Anything that has to do with critically ill patients has been an interest of mine over the years. One thing that I always emphasize is that the University of Michigan is well ahead of other major universities in supporting research. Most of the Ecmo centers in the world, of which there are now about 160, have come here to Michigan to learn how to do it and then went back home to set it up.